Certain things put you at higher risk for opioid overdose. Being aware of these risk factors can help prevent fatal and non-fatal overdoses. Know the things to do to stay healthy and to stay alive. There are 5 main risk factors for opioid overdose: mixing drugs, tolerance changes, using alone, drug purity levels, and your physical health.
Lots of people mix drugs because it increases the potency, but of course it also increases the risk of an overdose.
A lot of people mix a lot of stuff with alcohol, with pills, and just using one drug is a high risk as it is. Mixing them just increases it that much more.
Of course it overwhelms the body and the body can't process it all.
You are not sure exactly what you're getting yourself into, and it's harder for people to help you because they don't know exactly what you have in your system.
Mixing opioids with either benzodiazepines or alcohol has a multiplier effect. Instead of 2 + 2 equaling 4, 2 + 2 equals 8.
People usually mix their drugs to try to get higher.
But what actually happens is they're much more at risk for overdosing and dying.
The tolerance levels changes when people stop using for any amount of time.
People will stop using for a few days, either because they're in a detox, they're in jail, or they're just doing it on their own.
You could be in a detox for a while, or a hospital, or jail. So when you come out, you cannot use the same amount you used before you went in because your tolerance levels have been lowered.
If the people use the same amount that they're used to using, they're going to be at much higher risk for an overdose. To minimize the risk, a person should do a much smaller shot. We sometimes call this a tester shot.
Using alone is another risk factor. It increases it because you're alone. If something does happen, then there's no one there to help you, no one there to do anything.
People will use alone after they've been successful in a program for a while. They may be ashamed that they've relapsed.
They can just have just enough for them. They don't want to share. They just want to be alone for whatever reason.
The biggest danger of using alone is that no one will be there to call 911, and it could cost you your life.
No matter how much you know, how many techniques you have down, you're not going to be able to do anything if you've gone out.
Tell your friends that you're with that you're going to go off for a while by yourself. You really should let them know where you're going to be and how long, so that someone can check on you.
Leave the door unlocked so that if someone needs to come in and get you, they can. And have your cell phone programmed to 911 so that you can call emergency services if you feel yourself going out. Because heroin is illegal, there's no way to regulate it, and you can never be sure what you're going to get.
Sometimes overdoses come in waves due to bad batches or changes in purity level.
The dealers can use a process called stretching it out, which is adding other chemicals.
Dealer A can have something less potent than dealer B.
You may think that you're getting, say, 25% of heroin when you might be getting 75%, and that's a bad risk.
You don't know exactly what it is, then it increases your chance to overdose big time.
You can minimize that risk by knowing your dealer and knowing that it's the same batch that you've used before.
Know your source and listen to the word on the street.
If you've lost weight or you've been sick.
If you're unhealthy, it is an increase, to overdose because your body isn't functioning properly and isn't able to react the way a healthy body would react.
If you've overdosed in the past, it increases your chances of overdosing again.
Drug users have a much bigger chance of having hepatitis C or HIV, and this affects the liver's ability to clean out the blood. As a result of that, it takes a much longer time for any drugs to be removed from the system, and this means that you're at much greater risk for an overdose.
Women in particular need to be aware of using with members of the opposite sex because their body mass affects their tolerance level.
Men can usually tolerate more. Your tolerance level may not be the same as theirs, and so you put yourself at risk.
Knowing your risks and how to reduce them can help prevent overdose. For more information about this and other issues around opioid overdose, check out our other videos or go to our website, odprevention.org. Be safe and be well.